So you just had Botox like a week ago, and now your forehead feels tight, heavy, and you can hardly move, and it bothers you. Now you want to know what happened there. First, it could be related to the dosing. So, while more units could mean longer duration for Botox, but it can actually contribute to the feeling of heaviness. That's why it's best to stay conservative, especially if it's your first time doing Botox. Another factor could be like you isolated the area, meaning to say you only treated the forehead and you skip the frown, which you shouldn't be doing because, as I explain this to my patients, consider your forehead as the ceiling of your house. This is the foundation. So if you just treat the forehead without the frown, then what happens is the ceiling will drop down. So that can contribute to the feeling of heaviness. Another factor could also be how low Botox was injected. So if it's way too low, will contribute to the feeling of heavy. However, please note that these are not permanent side effects of Botox. So usually this feeling it starts few days to about a week or two, at the most 3 or 4 weeks. Then you start to gain some movement again. So on your next visit, tell your injector that you want a more conservative approach to avoid that problem.